Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
At what age should a young woman begin seeing a gynecologist for annual exams?
It depends on the situation. Many young women could benefit from seeing a gynecologist as soon as they reach menarche, or the beginning of their menstrual cycle, to start building a relationship with a gynecologist and talking about how to manage their symptoms if they're not comfortable during their menses. It's a good idea to meet with a gynecologist early on to talk about annual screening protocols and just in general healthy behaviors and routine women's health as far as avoiding STDs and safe sex practices. So I recommend young women seeing a gynecologist before they become sexually active so that they can have all of that information in making their healthiest choices.
Is there an age where a woman can stop seeing a gynecologist and just go to her primary care doctor for physicals?
Some women certainly can continue to go to their primary care physician for annual routine health screening as long as they are having an annual gynecologic exam. If there are any concerns, they have a history of an abnormal pap smear or a procedure that needed to be performed, then they may want to follow with a gynecologist who can keep a close eye on them throughout the years as things change. As they approach menopause, their cycles may change, their symptoms may change, and they may want someone who specializes in that to keep a close eye on them.
Is it important for a young woman to begin seeing a gynecologist even before she begins considering pregnancy?
I do think so. I think it's important to talk about optimizing your health before pregnancy. It's called preconceptual counseling. So it's something you may want to speak with an OB/GYN physician about before you begin starting your family. Additionally, if you had any questions about contraceptive methods to prevent having a family or healthy practices, it's a good time to see your gynecologist.
Are different screenings performed depending on a woman's age?
There are. So as young women become sexually active, in the age around 21, we start doing pap smear screenings, and that's to screen for cervical cancer. Those continue throughout your life. However, once you become closer to perimenopause or menopause, we recommend annual mammography for breast cancer screening. And then as you age and throughout menopause, we recommend colonoscopy, depending on your symptoms, particularly around age 50. And in your 60s, a DEXA scan, which is to scan for your bone density. Young women should particularly start coming in there before they become sexually active to talk about annual STD screening.
When choosing a gynecologist, what are some things a woman should consider?
I think it's really important to know yourself and to know what you're looking for in a physician, to find someone who you're comfortable with. Obviously, you want somebody who is well-trained and board-certified and board-educated, but usually in a gynecologist, it's a very personal field, and so you want somebody who you can trust to take care of you.